afternoon. My name is Brian Masse, Member of Parliament for Windsor West, NDP Industry Critic. I'm joined by Megan Leslie to my left, she's NDP Health Critic, and Paul Dewar from Ottawa Centre, Foreign Affairs Critic for the NDP. We're here on World AIDS Day to raise an issue that Canadians support universally across this country. And it's not every day that Canadians can make a difference in the world to this magnitude. This is one of those days. Every day, more than 16,000 people die in the developing world of AIDS. Many of them are children. Tuberculosis and malaria, and certainly HIV/AIDS, are some issues that we need to be taking seriously, and this country can do so. In the developing countries, as many as 10 million people need life-saving antiretroviral drugs right now. But on this World AIDS Day, 6 million of them are going without. They're not going to go because of the brand name drugs are expensive, and they're not actually getting the generics out to them. We need legislation on World AIDS Day. And we thought we achieved that 6 years ago when a bill was passed in this House of Commons that was actually going to provide generic drugs to developing nations. Unfortunately, I warned at that time that that bill was built broken. And sadly, to this day, we have not had the fix and the solutions for the licensing. Now there is a bill, Bill C-393, which actually has the one license, one drug system in place that could be successful. Unfortunately, this bill has been turned down in the House of Commons Committee for Industry by Mr. Mark Garneau voting against the bill with the Conservatives. We say that this is a time to change this and to make sure that Canada participates like I said it would by passing Bill C-393. Megan?
So with one vote left, we've run into trouble. The Conservative MPs and the Liberal Industry Critic, well, they've come together to amend this bill and to actually remove the one license solution. And they need to understand that this stops everything that we're trying to do. If they kill the one license solution, then generic producers will still be locked out, low-cost drugs still won't be shipped, and millions will still be suffering needlessly around the world. Ça n'a pas besoin d'être ainsi. Le Canada est si proche de faire la bonne chose. C'est ce que veulent les Canadiens. Et le Parlement doit commencer à écouter les Canadiens, non pas les lobbyistes de l'industrie pharmaceutique. L'Afrique représente uniquement 2% des ventes de médicaments d'origine. Sauver des vies est plus important que d'accumuler des profits. So today we're calling on every MP to do the right thing and pass Bill C-393 with the one license solution intact. And we're encouraging Canadians around this country to speak up now and insist on leadership from their elected MPs. Thank you. Paul?
Thanks, Megan. Thanks, Brian. It is also important to understand what Canada's contributions are when it comes to HIV/AIDS in the area of fighting for medicines that work and medicines we can deliver to people who need it. But we also must take a look at what Canada is doing to invest in solutions like the AIDS vaccine. Look at, right now, the number one killer of women at the reproductive stage in their life in the developing world is AIDS. If we're going to make a difference in ensuring that women don't die needlessly in the developing world, we need to get behind innovative solutions. Sadly, groups that have come forward and applied to CETA to continue funding that we used to support for projects that are now making a breakthrough have not heard back from this Conservative government on their application. Specifically, we were innovators and supporting innovations around an AIDS vaccine and methods to ensure that women particularly would avoid the HIV and, of course, the AIDS virus in the end. What we need to see is our government at least respond to requests that have been made to the tune of $20 million to continue the work that our government and our country had committed to. So today we're not only asking for our colleagues to pass the legislation that was noted by my colleagues, we're also calling on our government to respond to the applications to continue the work in finding and providing an AIDS vaccine and supporting women in particular who need the support of Canada. In other words, people are calling, will this government answer? Thank you.
Thank you, and we're available for questions.
What mechanism are you hoping to use to get the one license clause back into the bill?
We're going to actually put it back in the legislation. We can do that now that it goes back to the House of Commons. The procedure allows us to put that clause back, and there will be a vote on that clause. So those that gutted the bill, the Conservatives and Mr. Garneau, will have an opportunity to actually vote the proper way, we're hoping, and to restore the one license, one drug regime. And what's important to note is that there was a great deal of compromise at committee. We struck out of the bill a number of different clauses that had issues that we didn't believe were real, but were certainly causing problems for others. And we're hopeful that we can actually have some compromise on this, because with only one, drug application by Apotex by this legislation, it's clearly not working.
What about the vote that needs to take place for you to officially take up that bill? When is that slated to happen?
There's no date for that. December 16th is when we'll have the first opportunity to discuss this in the House of Commons, and there'll be a second time in the new year. And then from there, after those votes take place, will be an opportunity, hopefully, to have unanimous consent to have the bill transferred to my name. And I should note that that's been done in the past for Mr. Harper. So we're hoping that there's going to be consistency there. Thank you. Oh, no, go ahead. That's okay.
Sonia Bell from iPolitics, and I'm wondering, you're centering out Garneau here. What happened at the Industry Committee meeting? Were the Liberals split on it?
Yeah, it was really interesting. What happened was that Mr. Garneau introduced a clause that he wanted to have added to the bill. That was defeated by everyone else on the committee, and then so Mr. Garneau joined with the Conservatives to gut Clause 4 out, which is the one license, one drug regime. This was pretty shocking because, Mr. Garneau split from the other Liberals and basically said at that point in time, by the set course of action, that the bill would be basically destroyed and there would be no sense of actually passing the rest of the legislation. So it was pretty shocking to see, a Liberal, especially in the Critic portfolio. And I don't know whether there's games going on with the Liberal Party in this. I don't know. I'm hoping that there isn't. The other two members supported the bill, and I believe other Liberals actually do support this bill, and perhaps we can get this back on course, and I think it would be appropriate when we have the vote in the House of Commons that Mr. Garneau can recover from that at that point in time.
You mentioned compromises. Can you tell me what the NDP compromised on?
Yeah, there's a number of different things that this bill unnecessarily has, say, for example, drugs that are listed on it and countries that are listed on the actual legislation. That wasn't required under TRIPS and Doha and the agreements of the past, and we built that into these are other barriers into the actual bill. There was concern expressed about that. There was, say, for example, as well, Health Canada approval process, which wasn't necessary. We've decided that, fine, we'll agree with that. We'll keep that in the bill. So we took out a series of things that were concerns related to also security of drug products so that they're not used improperly. So we've compromised quite a bit here because there's so much support this from non-government agencies around not only just Canada but the world. We wanted to see compromise take place. And where this really goes to heart is that we built legislation that doesn't work. And I warned at that time that we were doing that and setting a precedent for other countries that did the same after this. And so we need to be the leaders to solve this problem. If we're really talking about having a one drug, one license regime, it won't cost taxpayers money. It will actually provide the drugs that are so desperately needed for men, women, and children. And it'll also actually create employment, as there will be production of drugs. So there's a lot of upswing in this, and I'm hoping that we can get it recovered.
Question for Paul about if you can elaborate a little more on what some of these groups are who are applying for funding and got denied.
Sure. If you go back in time and specifically to 2000, 2005, both of those dates, there was provisions provided. There was two groups who had accessed funds who are now coming together to ask CETA to renew funding. And basically what they had been doing was getting funding for, as you know, the innovations in and around the HIV vaccine. And it was the IPM and the IAVI. And the IPM in particular was, I'm just giving the numbers here to you now. Canada had been a strong supporter of global HIV prevention efforts. From 2005 to 2009, Canada contributed $30 million to IPM, and between 2000 and 2009 contributed 82 million to IAVI. And what they've done is those two groups have come together to form one ask of $20 million so that they would be able to get behind a joint initiative to continue the work that they had been doing. I also note that the trials that have come out recently have shown strong efficacy just this month, back in November, sorry. There was results related around oral pre-exposure, prophylaxis, as well as other drugs that have been in trial in situ and showing strong efficacy. So this isn't about what we'd seen, 10 years ago, or even 5 years ago, where they were saying, well, this is still in the lab, we're still looking at whether or not these approaches have efficacy. We're breaking out now with data and control groups that are showing there is efficacy around the vaccine and some of these approaches. So the question is, right at the time when Canada has been supporting other agencies and groups internationally, and we're showing good results, why aren't we continuing to support this in 2010? We did so in the past. And so I guess, what our call is today, is along with the legislation, is to hear from the minister who won't meet. They've been requests to meet, Minister Oda. They want to know, are there in fact going to be, is there going to be support from this government for these initiatives? And if not, why not? They've been asking since last spring. And that's when the funding, from the previous provisions rounded up. And here we are going into the next budget year almost, and still no answer.
Thank you.
Thank you.
Thanks.